So for things to go consistently right, we need a well-designed and well-executed plan. And the plan is nearly a foolproof system and executed by well-trained people.
I'm Dr. Rick Steedle with some useful ideas for the successful, not stressful practice.
The buzzword is practice management, but actually you shouldn't be just managing your practice. You should be spending time improving your practice. What I want to talk about is what is a systematic way to systematically improve your practice. Whether you start a practice, you're an associate, or you buy a practice, how do you build a practice that works? By that, I mean, how do you build a practice that day in and day out runs smoothly, patients are taken care of, the staff knows what to do, and the whole practice is systematized in such a way that rarely do things go wrong. In order to get to that point, you have to be able to implement some kind of change from where you are to where you want to be. About 10 years into practice, we went into crisis. And we went into crisis because we were in a period of high stress. Things weren't working well. Patients weren't being seen on time. Staff wasn't getting along. And we had to work our way out of this. We had to change our approach by beginning to working on the practice, not just in it. Up to that point, we had been making changes, but we really hadn't been systematically looking at our practice and saying, how do we need to change this to continue to grow into the future? We're working in crisis management. How do you think in crisis management? You simply ask the problem and you immediately go to a second question, the question of how do we fix it? So new patient numbers are down, we've got to do something about marketing. Or one of the chairside assistants is slower than the rest, I've got to do some training. Or the TC is not getting the information to the financial coordinator for payment arrangements, I got to talk to her about it. Front desk is putting those emergencies in the wrong place. I got to go straighten that out. And it's just on and on and on, putting out fires only to have another one pop up somewhere else and you have to go fix it. And the difference that we did at that 10th, 11th year was we said, we want to manage it by design. We want to approach all of our problems differently in that we want to identify any key issues we have. We want to formulate solutions that encompass all the issue. And then we want to develop foolproof systems and procedures that can pretty much guarantee that that problem won't arise again. And so it's a plan for how the new patient's called, a plan for how the insurance is filed, a plan for how to communicate to our referrals, and even a plan to how to make every patient feel welcome at every visit. And the thing about management by design that's different than crisis management is that it's a written plan. In other words, you have thought through the issues, you've looked at all the repercussions of those decisions, and you said, here is a written plan that we can guarantee a good result if we follow it. So for things to go consistently right, we need a well-designed and well-executed plan. And the plan is nearly a foolproof system and executed by well-trained people. But how do you get there? How do you get to that point? I talked to you about the non-dental example, which is Walt Disney, when he was trying to put Disneyland together, he didn't look at amusement parks and say, what are all the problems in amusement parks? If I can solve all the problems with amusement parks, then I'm going to have a great place. Let's see, they're dirty, employees don't care, the games are rigged. Instead, he asked a fundamentally different and more powerful question, which is, what do I want to create? So he began to imagine a place that people from all over the world are going to come to his amusement park. And so what I want you to do in your practice is begin to be thinking not so much of how do I fix my problems, but what kind of practice do I want to create? But even at a smaller level, we want to know what kind of collection system do I want to have? What kind of experience for the patients do I want to create? What kind of relationship do I want to have with the dentist? How do I create that relationship? And it's a totally different way of approaching the problem than just saying, okay, there's a problem over here we need to deal with. We talked about the 4 things to do in practice. These were the right direction. In other words, have a clear idea of where we want to be 1, 2, and 3 years from now. Then we need to focus on the right priorities. In other words, we need to make continuous improvement on the things that matter most to drive our practice forward. Then we want to have this strategy. What are the steps that we need to take that idea that we have, to take that priority we have, and actually create it in the practice? And then finally, once we have this strategy, which actions should we take and which ones shouldn't we take because time's limited? So these practices that get to be successful take those right actions by consistently implementing the plans and systems that they've come up with to move the practice forward.
In this next video,
You'll discover how to figure out which one of the urgent problems you have you should resolve first, and how to break down that major issue into minor problems so you can more easily solve them. And finally, what's the fastest way to make it the way you want it? So go check it out.